We're going to start off by talking about bag valve mask technique, and what I really want to emphasize is good technique for bag valve mask. If you have a patient that you need to, you attempt to intubate and you fail to intubate, you're going to be okay as long as you can bag the patient. If you can't bag the patient, you're going to have a problem. So we're going to talk about the best strategy to employ when bagging the patient. So first of all, there are a couple elements that are important when you're going to attempt bag valve mask. First of all, you want to make sure that the patient is in the best possible position. The best possible position involves aligning the patient's external auditory meatus with their sternal notch. It's called ear to sternal notch positioning. Secondly, you want to place an oral or a nasal airway. I prefer to use a nasal airway, but you can use whichever one you're comfortable with. So you're going to make sure they're in a good position, and then you're going to put in an oral or nasal airway. Then thirdly, you're going to hold the mask using what's called the EC grip. So your thumb and your forefinger are going to form the C, and your other three fingers are going to form the E. The C is what holds the mask to the face, and then the other three fingers will lift and distract the mandible. Holding the mask should be a two-handed technique. Unless you're in a scenario where you're the only rescuer, you should hold the mask with both hands. It's much easier to hold with two hands, and you will get a much better seal than you will with one hand. So in order to hold the mask, you want to place it on the face. Put your thumb and forefinger around the mask to hold the mask to the face, and then grasp the jaw, grasp the mandible with the other three fingers and lift and distract. So once again, to review, you want to start with an ear to sternal notch positioning, external auditory meatus to sternal notch, place an oral or nasal airway, hold the mask with two hands using the EC technique, and put your other three fingers on the mandible and just lift and distract the jaw. And then lastly, when you're bagging, in order to minimize gastric insufflation, you want to make sure that you're using a slow rate and you're using small tidal volumes. This is roughly a 1 liter bag. Your ideal tidal volume is about 600 to 700 cc's. So you're not doing this, you're doing this.